Sure, and I think this nurse sounded as though she was surprised by this, as was everybody else. But if a healthcare worker goes to West Africa, deals with Ebola patients, and knows when they come back, they'll be in a 21-day quarantine, what is the harm with that?
Well, the harm is that it is totally disruptive of their life if you put even a person who's no risk to anyone else.
Well, gosh, so's going to West Africa to treat Ebola patients.
Well, exactly, but we want them to go because they are helping us to protect America by being over there. What I think people need to understand is the scientific evidence tells you that you're not going to transmit it. We don't want to be cavalier, Candy. There are ways of monitoring people. There's passive monitoring. There's active monitoring where you take your temperature.
There is monitoring now
really,
at airports,
and yeah, but I'm talking about when they come home and they're in their home. If in fact they're at a certain risk, they will then be actively monitored in the sense of somebody taking your temperature, asking you if you have symptoms. There's a big, big difference between completely confining somebody that they can't even get outside and doing the appropriate monitoring based on scientific evidence.
But this is based, I think, on a doctor who came back, had been treating patients in Guinea. He comes home, he's fine for 4, 5, 6, 7 days. All of a sudden begins to feel tired. Night before he comes down with a fever, he's out bowling and eating and doing ordinary things. And then obviously gets a fever, reports himself, they come get him. You would eliminate a lot of that. You would not be worried about his fiancée. You would not be worried about the bowling alley. The New York governor would not have to walk down the streets to prove that everything is just fine in the subways. If you had it, you say, look, a doctor, you've been treating Ebola patients, time for you to take 21 days off.
There are monitoring guidelines that tell you how you can do that and accomplish the same goal. For example, the monitoring would have picked up at the time he got symptoms and a temperature. Before that, he was not infective to anyone. I know sometimes it's difficult. People want to be completely 100% risk-free of anything. When you do that, you might have the unintended consequence of having people not wanting to go over there. And if that's the case, they're not going to do very well if they don't have doctors and nurses that are helping them.